Hello. Obesity and diabetes are rising fast in India, and the numbers tell a worrying story. Today, almost 1 in 4 women and 1 in 5 men in our country are overweight or obese. Among women over 20, that's 44 million living with obesity, and for men, it's 26 million. And this just isn't an adult issue. Childhood obesity is on the rise too, affecting millions of boys and girls before they even turn 19. At the same time, India has now over 101 million people living with diabetes, the highest number in the world. The prevalence has climbed from 7% in 2009 to over 11% today. And I'm talking about the adults here. And here is the real concern. More than half of these cases may not even be yet diagnosed. These two conditions are closely linked and they are becoming more common across all age groups and will have serious long-term effects if left unaddressed. So what's the way out? Is it enough to just control and watch your diet and exercise? Or is there a proven way that will work better for long term? To help us get these answers, we are joined by a renowned doctor, Dr. Randeep Wadhawan, Vice Chairman of GI Minimal Access and Bariatric Surgery at Max Super Specialty Hospital, Dwarka, New Delhi. With over 35,000 surgeries performed and decades of experience in bariatric, metabolic, and robotic GI surgery, Dr. Randeep is one of India's leading experts in this field. Today, we'll explore how bariatric surgery can not only help with weight loss, but also reverse diabetes, improve overall health, and give people a new lease of life. So, welcome, Dr. Wadhawan. We are very privileged to have you today. Welcome.
Thank you so much. Thank you.
Yeah. So, yeah, you're welcome. My first question is a very common question, but yet a very important one. Is it common to have both diabetes and obesity at the same time?
A very good question and a very important one. Obesity and diabetes go hand in hand. They're almost always together. With increase in obesity, or we say an increase in the body mass index of a patient, of a person, body mass index is calculated by weight in kgs divided by the height in meter square. So as the weight increases, the BMI increases, that increases the adiposity of the person, adiposity around the waist circumference, which causes an insulin resistance and leads to more diabetes. So yes, diabetes and obesity go hand in hand, and with increase in weight, the incidence of diabetes almost always increases.
Very well explained, Dr. Wadhawan. I think that sets the stage for the next question. Apart from diabetes, does obesity cause other diseases also, which we should be mindful of?
Yeah, so obesity never comes alone. So you've already mentioned that diabetes is almost always directly associated. There are lot many diseases which are associated with obesity, blood pressure, hypertension, cardiovascular risks, certain cancers. Now, cancers, when we look at females, the breast and the endometrial cancers. When we look at males, we have colorectal, esophageal cancers. Then for both sexes, it could be pancreas and liver cancer. So almost all cancers have some kind of a close association with obesity. Apart from that, reflux issues, almost always the obese will come with the fact that they have got a lot of reflux, the food is coming up. Joint problems because they're carrying extra weight. So those are the weight bearing joints. So they would have a problem in their joints. Then these patients would also complain of sleep apnea. They can't sleep at night. They would require all these machines. Females coming with infertility, particularly with polycystic ovarian diseases. So all these come associated with obesity. It never comes alone.
Right. So you have actually explained really well how internally and externally obesity can cause a lot of havoc if not managed in time and well. So that naturally brings me to the next question, that what are the options really to manage this obesity, and because it has such long term effects. So if we talk about management, is there any option that can help you manage obesity long term?
Very nice. So we have multiple options, but the cornerstone of the management is diet and lifestyle. Okay, so the treatment goes in a form of a pyramid. Almost in all sections, its diet and lifestyle is absolutely mandatory. So the person needs to change his or her own diet and has a better lifestyle. That's the cornerstone. But then after you reach a certain weight or a certain body mass index, then the just diet and lifestyle will not work. That's when you need to move on to the next treatment, which is adding pharmacotherapy. So you add some medical treatment so that these patients do well and they revert back to normalcy. But then once you hit a body mass index beyond 35, and which is very common, you in fact mentioned in your introduction as well that we have a huge volume of people with obesity. And it's not just obesity, obesity class 1, you move on to class 2, higher obesity. Those are the kind of people, then we advise that you should consider a bariatric or a metabolic surgery, which would help you to get back to a normal, near normal weight, and also ensure that all your comorbidities improve. So that's how the pyramid goes. But like I said, diet lifestyle continues to be the cornerstone, whether you go for a pharmacotherapy or you opt for bariatric or metabolic surgery.
Okay, so I think you've managed to lay down the facts that which stage or which classes a person is for to be able to qualify for bariatric surgery, and I think that kind of information is very important for our audience here. But I would like to get to a more basic question, that if you were to explain to a potential patient, how does this bariatric surgery actually help? What does it do inside the body that kind of helps control the, or probably cup it, as we say, nip it in the bud? So if you could help us explain that.
Very nice. So, what happens is that, like I mentioned, the indications for bariatric surgery starts at a body mass index beyond 35. For the Caucasian and the Westerners, the body mass index is slightly higher. But we Asians, in particular the Indians, get their comorbidities, which we've already discussed. They get them a lot earlier than the Caucasians, and therefore the body mass index is 35 and above. And we've published that in our the Indian guidelines as well, and that's what it says. Now, what we would do in bariatric surgery is it's not an open surgical procedure. It's a simply a laparoscopic procedure or a robotic procedure. You do it by either ways. You make these small holes, but primarily what you do is you alter the gastrointestinal tract. So either you reduce the size of the stomach or you reduce the size of the stomach and bypass a part of the intestine. So you alter the GI tract. Now, when you alter the gastrointestinal tract, one, it induces two things. Number one, it restricts the entry of food inside. So once it restricts the entry of food, you obviously eat less, you feel full or you feel satiety a lot faster, and therefore you improve in all your and you start to lose weight. Now, the second action is neurohormonal changes. So once you do the bariatric surgery, there are certain hormones which get stimulated. Those are in the form of GLP-1, GIP, PYY. So many hormones which get stimulated. Now these hormones act in various ways. One, they reduce your appetite. Two, they improve your comorbidities, particularly diabetes, by inducing pancreas to produce more insulin and therefore reducing your sugars. They also sensitize the insulin receptors so that the same insulin, the endogenous insulin, which is produced in the body, acts a lot better. And that there again, it improves the diabetes. So all these hormones will have all the beneficial effect. In fact, just for the lay persons, they'll always hear about GLP-1, because all these newer pharmacotherapy, they are all GLP-1 receptor analogs. Now, what we do in bariatric surgery, we induce an increase in the GLP-1s without receiving the GLP-1s from outside, and they remain high in the patients even 20 years after a bariatric surgery, suggesting that it's a permanent increase in GLP-1s which we induce, and therefore you start feeling fullness or improving your comorbidities even 20 years after after your bariatric procedure.
Okay, so you've actually answered my next question. Is that this surgery's impact or the long-term effects for a patient who undergoes it is actually for lifetime or 20 years or 30 years? Is there a time?
Yeah, very good. So that's a question which is almost always asked from us when a patient walks into our OPD. That one, is this surgery which was discussed, is bariatric surgery discovered just a few years back? No. So one, it was discovered way back in 1967. So we are looking at nearly 60 years now. So bariatric surgery has been, evolution has taken place, but it was discovered 60 years back. Now that coming to your question, that what is how long does it last? Now there is enough data to support that. The data suggests that, let's say, if you're looking at just the weight loss, then the beneficial effects have been published 20 years hence as well, and averagely the patient is loses nearly 60% excess weight loss. So excess weight loss is calculated based on what should be your ideal weight and what is the current weight, and we calculate a percentage of that. So excess weight loss more than 60% even after 20 years has been well documented, and we've seen in our own data also beyond 15 years, averagely the excess weight loss is more than 60%. If you look at total weight loss, so okay, so somebody's ideal is that from 100, if you are at 80 and less, then the procedure is a successful procedure. Okay, so 20%, more than 20% weight loss is considered to be a successful procedure. Now we've seen even after 20 years, averagely, patients have more than 20% total weight loss and they maintain that weight loss. So suggesting that these bariatric surgeries for obesity work even 20 years and more. If you look at comorbidities, like we discussed, diabetes. Now, in diabetes, again, there is enough data to support that the improvement of diabetes. When I say improvement, I mean somebody who's taking insulin comes down to, let's say, oral medication, or if he's taking oral medication, is not taking any medication. So improvement in diabetes, even after 15, 20 years, is more than 80%. And when we look at complete remission means a person achieves a normal HbA1c levels and has normal blood sugars of fasting of less than 100 and is not taking any medication. Even those people who reach remission is more than 50% in a long term, suggesting that improvement guaranteed, remission more than 50% will probably not require any medication after a bariatric or a metabolic.
Once a patient has undergone the bariatric surgery, how important is it for him to continue the fitness and maintaining diet, or can he now afford to become relaxed and take liberties with diet and lifestyle? So I just wanted to know a little bit more about that.
So very importantly, diet and lifestyle, like I mentioned, is the cornerstone of management of obesity, and that's irrespective of the person's body mass index. Doesn't matter what the body mass index is, and that has to continue even after a bariatric or a metabolic surgery. General perception is, okay, so now we've had a surgery, we can have anything we want and we won't gain weight. No, you can regain weight after a procedure as well if you do not follow the right diet. Now, What we advise post surgery is that you should have a high protein diet and less of carbs and fats. Generally, in a normal human being, the total content of proteins is about 20% of the total diet. It's 40% carbs, 40% fats, and 20% proteins. But post surgery, we advise that that 20% should be made 40% for the proteins. The rest can be carbs and fats, but the protein content should be 40%. Now, let's say somebody is 100 kgs. We always suggest that you should at least have 100 grams of proteins post surgery. That is mandatory. Now, you can take that in the form of diet. It could be eggs, it could be fish, chicken, or any of the non-vegetarian diet. Or if somebody is a vegetarian, then we obviously advise food which is rich in protein content or commercial preparations, just to ensure that they have the right kind of diet. Apart from that, we also suggest that you can have what you want, but if something which you like could be high in carb content or a fat content, that has to be limited. It can't be in large quantities. It has to be just limited to ensure that you have little of what you would earlier have, but always ensure that you have a high protein content in your diet.
Okay, understood. So, protein is the key word here.
Yeah.
You briefly mentioned that the surgery itself is not invasive. Yet, typically with any surgery, there will be a little bit of reservations. So, are there any risk factors associated, and is there any particular kind of group that you would not recommend undergoing this surgery? Are there any risk factors?
So very good question. So that's a question which is almost always asked from all our patients who walk in. That how risky is this surgery? I hope we'll be fine when we go home. So a lot has changed. Surgeons, equipment, everything has changed over a period of time. And today, with the kind of experience that the surgeons have, with the kind of equipment which we have today, it has by and large become as safe as surgery per se has become as safe as any other elective procedure. Let's say if in laparoscopy, like a hernia surgery, or as simple as a hernia, or in if you look at urology, like a prostate surgery. So common surgeries, it has become as simple. Yes, some of these patients have got high comorbidities. They are high risk. We need to optimize them before we take them up for a procedure. We require a multidisciplinary team, wherein we require a cardiologist, an endocrinologist, ICU, intensive care, a good anesthetist, nutritionist, pulmonologist. So all those, it requires a multidisciplinary team. But like I said, the surgery per se has become a lot easier. We are taking all precautions to avoid all kinds of risks. Patients may still have risk because of the comorbidities. Those, of course, we need to understand, but like I said, we will optimize them so that the risk is as minimal as possible. Uh, I'm also the current president of the Obesity Surgery Society of India. We have centers of excellence all across the country where we follow certain SOPs and protocols to ensure that these surgeries are absolutely safe. Our center is one of those centers of excellence, and in these centers, we have a stringent rules and look at all the SOPs which are followed and the outcomes as well. And the outcomes can be compared with the best in the world. So yes, the surgery, the disease itself is a bit risky, but surgery, we've tried to make it as simple and as safe as possible.
Right. That's very important to know that it's a safe surgery for so many people who want to undergo something like this. But my next question is on more on the practical side. A person who wants to undergo, how many days should he keep aside? Like, is it a day procedure, morning in, evening out, or you need to stay overnight? And approximately recovery time.
Very nice. So these surgeries are either done, so they are, like you said, they are minimally invasive. They are, in layman terms, they are keyhole surgeries. We either do them laparoscopically by making those holes, or we use the robotic instruments to do these surgeries. Again, similarly, the holes are very small. Procedures, by and large, depending on the type of procedure and the BMI of the person, can be anywhere between 1 hour to 2 hours maximum. Generally, 1 hour to an hour and a half is what it takes for any of these procedures to happen. We have a 3 day of hospital stay. The patients would be admitted a day prior to the procedure, worked up. If a patient is high risk, we may admit a patient even before that just to optimize them. But generally, most people would get admitted a day prior, do the procedure next day. We have avoided using the ICUs now. They can be shifted back to the room. They are mobile. Okay, so they can walk to the toilet themselves and they can move around the same day. Next day morning, they are on a full liquid diet. We generally would stop the IV fluids, and a day after that, so that is 3 days of hospital stay. The fourth day morning, they are back. We discharge them. They can be back to the normal activities. So physical activities, we do not advise rest. It's only the diet is what we advise, that they need to take smaller quantities frequently, liquids for a period of 10 days to 2 weeks, soft diet for another 10 days to 2 weeks, and thereafter a normal diet. Most people are working because the average age, what we are getting in our own data, is 44. Males and females on an average is 44. So if we are getting an age group of 44, most of them are working. We tell them they can go back to their work 3 days after the discharge. So at best they require is what, 7 days, 3 days in the hospital, 3 to 4 days of rest at home, and they can be doing all those activities as they were doing earlier without any restriction. So they can be pretty much back to their normal routine, except for a diet, which obviously is advised. And yeah, and then they are moving around and doing all their normal activities.
Great. I'm very glad to hear that it is first of all minimal risk, and the fact that it is not that which is going to stop a patient's life. You can easily get back to your life in a couple of days, fit and fine. So very glad to hear that. That brings me to the next question, which is again very very practical. What about insurance? Is this covered by medical insurance?
Yeah, very good. So this is something which I'm sure the audience would like to know, whether insurance covers bariatrics. So a lot of work was done by Obesity Surgery Society of India, and so the good news is way back in 2020, 1st October 2020, almost all insurances recognize obesity is a disease, is a big disease with a lot of comorbidities, and they have approved a bariatric surgery in insurance. Now, so there was earlier obesity was an exclusion. That exclusion has been removed, and bariatric surgery is approved. Only thing is they want that the insurance that they've taken should be a valid insurance and continued insurance for at least a period of 4 years. So if they have an insurance which has been for a period of 4 years, by the fifth year they can get approvals for bariatric and metabolic surgery without any problem. And so it's been from 2020, it's been 5 years now. And initially there were some hiccups, but those have all been ironed out, and now most people would get covered by bariatric and metabolic bariatric and metabolic procedure. Only thing is, for them, they have not changed the indications. They follow the same indications which are there in the Western world, which is body mass index of 40 and above, without any comorbidities would be an indication for the procedure, or more than 35 with one of the comorbidities or two of the comorbidities like cardiovascular risk, obstructive sleep apnea, diabetes, cardiomyopathy. So some of these issues, if patients have this, then 35 and above will also be covered for the procedure. So those are the indications where you get complete insurance cover.
I think our audience will be thrilled to hear that this is being covered by medical insurance, and perhaps that will be one more reason for motivation, apart from the main reason, of course, is to be able to live life more productively, fit, health wise. So, very, very illuminating. Any last piece of advice for the viewers, short and sweet, before we conclude this very, very insightful interview?
Thank you. So yes, so like I said, there's always prevention is better than cure. So I would always suggest that people should get healthy. No, even our prime minister is talking about the fact that you should get to healthy food and healthy diet and a better and a healthy lifestyle. Though it's difficult in the metros these days with all the construction which is going on, but at the same time, all around, we must take out time for ourselves, have a healthy diet and a healthy lifestyle, which will ensure you don't get into the obesity and higher BMIs and so on and so forth. But just in case that happens, we have multiple options available as on date. We have pharmacotherapy, and then even bariatric surgery in our part of the world, at least in India, has become very safe, and the outcomes are excellent. Patients are actually going home much faster, and multiple options available now. So yes, my final word would be get to a better and a healthy lifestyle, and we know a healthy individual will give us a healthy society and economically a more vibrant India. So that's my suggestion and advice to people at large.
Vibrant India, golden words said there, Dr. Randeep. Thank you very much for sharing your expertise and really real world perspective today. You've actually shown us that you can address obesity, diabetes, and it's not just about weight loss, but it's about restoring health, preventing long-term complications, and giving people their lives back, simply put. For all of you who are watching today, remember, the sooner you act, the more options you have, and the better your outcomes can be. So don't wait for those symptoms to escalate. Speak to a specialist, explore the solutions, and take the first step towards lasting wellness. Thank you once again, Dr. Randeep. Thank you to all our viewers for joining us. Until next time, stay informed, stay proactive, and take charge of your health. Goodbye.
Thank you very much, and thank you for inviting me. Thank you.
Golden words said there, Dr. Randeep. Thank you very much for sharing some great insights and expertise on this very important topic today. You have explained that diabetes and obesity are not life sentences, but actually reversible if tackled well in time and acted in more moderation throughout thereafter. So, thank you once again for all the viewers, to all the viewers out there for watching this very important episode, and I'm hopeful that you would have learned a lot, and this will help you to make informed decisions and take charge of your health. um, Thank you. Goodbye until next time.